The first approach we're going to talk about is hypothesis testing. In this case, with two independent groups, we're going to be using the two-sample binomial test. And our null hypothesis is that the outcome proportion for the intervention group is not better than the outcome proportion for the comparison group. And that could be greater than or equal to or less than or equal to, depending on what you're talking about. If you're talking about the number of clients who continued using their prosthetic, then you would want the intervention group to have a higher proportion of clients who kept using their prosthetic. If you're talking about recidivism in prison, then you want your intervention group to have a lower proportion of clients who went back to prison. The alternative hypothesis is that the outcome proportion for the intervention group is better. And what the two-sample binomial test gives us is a p-value, a probability that if this is actually true, our null hypothesis, that there really is no difference or the intervention group does not have a better proportion, what's the probability that we would have seen the results that you saw, that the results for the intervention group and the comparison group? And if the p-value is less than 0.05, that tells us that the difference is statistically significant. For example, say you're working with clients with prosthetics. 22 of your clients choose a myoelectric prosthetic, which is fairly expensive. 30 clients choose a body-powered prosthesis. And what you want to know is there a difference in the number of clients who abandon their prosthetic, so discontinue using it? Over the course of 6 months, you contact your clients after 6 months after they've received their prosthetic, and what you find is that 15 of the myoelectric prosthetic users abandoned their device and 7 didn't. 14 of the body-powered prosthetic device users abandoned their device and 16 didn't. So clearly, there is a difference between these two groups. Is that difference statistically significant? So using the two-sample binomial test, you compare the two comparisons, and the result you get is a p-value of 0.06. So there's a 6% probability that even if there's no difference between abandoning their prosthetic, you would have seen this difference. So that's not a statistically significant difference. On the other hand, it is pretty big. So about 50%, a little over 50% of people kept their body-powered prosthetic, but only about a third of clients kept the myoelectric prosthetic. So this difference isn't statistically significant. It may be clinically significant in the sense that you want to look at it further. You might not stop giving myoelectric prosthetics based on these results, but you might change the way you're doing it, or you might investigate further, look at additional clients, take a bigger sample over the course of a year, and see if this result is statistically significant and does hold up.